for joining us tonight. We will be talking about the highly regulated healthcare system and the focus of the functions between state and federal agencies. We will be talking about 6 different agencies tonight. First, we will be talking about the Center of Medicare and Medicaid. They are committing themselves to the health and the well-being of all and have the wealth of experience in the issues related to advancing health equality and improving the health vulnerable populations. They would like to ensure that the voices and needs of the populations are represented in the agencies that are being developed and implemented and evaluating its programs and policies. They would also like to achieve the highest level of health and disparities in the healthcare quality and make sure that all access is granted to those who need it. CMS is a public foundation that is part of the U.S. government. Some of the pros and cons of the agency are that the Medicare costs are very little each month, and they lead to the prescription interventions, and they also have resulted in an increase in the medical standards. However, there's a huge amount to the administration costs, and they also have a huge cost for the elderly that are enrolled in the Medicaid. Next, we have the NIH, which is the National Institute of Health. They seek a fundamental knowledge about the nature and behavior of living systems and the application of the knowledge to enhance health, lengthen the life, and reduce the illness and disabilities. The goals of the agency are to foster fundamental creative discoveries, innovate research strategies, and have their applications for the basis of ultimately protecting and improving health. They want to develop and maintain and renew scientific, human, and physical resources that ensure the national capability and prevent diseases. They want to recognize the causes and diagnose and create prevention methods for the human diseases. They want the process of human growth and development to increase, and they want to understand the mental, addictive, and the physical disorders. The NIH is part of the U.S. Department of Health and Human Services. It is a nation's medical research agency making important discoveries to improve the health and save lives. Some of the impacts that the NIH has is helping people live longer and healthier lives, making diseases less deadly. The impact they have on society is they support jobs in science and they help the economic growth. They enable more productive economy. They've also helped driven the discovery and the translation of innovation ideas and help combat major health challenges. The next organization that we'll be talking about is the U.S. Department of Health and Human Services, the HHS. The mission of the Department of Health and Human Services is to enhance and protect the health and well-being of all Americans. They want to fulfill this mission by providing an effective health and human services and fostering advances in medicine, public health, and social services. The administrators have more than 100 programs across the operating divisions, and they protect the health of Americans by providing essential human services, which can include HIPAA, which protects your health rights, inclusion into health insurance, social services, prevention and wellness, obtaining providers and facilities, overall public health and safety, emergency preparedness and response, and of course, research. Although the Center of Medicaid and Medicare Services outline how exchanges like insurance should be verified to reach out to members to auto-enroll themselves in programs, the HHS is looking to make sure that the consumer is going to be auto-enrolled. However, this can have a overhead cost reduction for the administration, but consumers might be able to secure a better coverage for their money by revisiting options to switching plans. This program is very, very similar to the Center of Medicaid and Medicare. They work closely together, and they try to make sure that everyone has access to that health care, whether it is looking for a new plan or being auto-enrolled. The CDC, or the Center for Disease Control, aims to protect Americans for both their health, safety, and security threats from both foreign or in the U.S. This streams from diseases that could start at home or abroad, chronic or acute, curable or preventable, and of course the human error or deliberate attacks. The CDC fights diseases, supports communities and citizens to do the same. The CDC is basically focuses on the health security of Americans and the communities. They put the science into action, and they're helping the medical care for fighting diseases before they reach borders, either that's statewide or in the entire United States. And they work very closely with public health organizations to contribute significant resource and making sure that public health leaders are capable of dealing with diseases. The Congress actually made this nonprofit organization for the sole purpose of creating a healthcare protection mission. They also built this to save and improve lives by unleashing this collaboration between CDC, philanthropy, corporations, organizations, and the individuals to protect health and safety and the security of America. Some of the benefits specifically towards public health from the CDC consist of constant communication and reporting. They have improved the analytic capabilities, the promotion of higher standards in a community for health, and they support the promotion in key national initiatives. They also have created advancements in specific capabilities and also linking geographically disparate practitioners and increasing government efficiency. Our next organization is the U.S. Food and Drug Administration, the FDA. They are responsible for protecting the public health by ensuring the safety and efficiency and security in human veterinary drugs, biological products, medical devices, and ensuring the safety of our national food supply, cosmetics, and products that emit radiation. They also are an agency within the U.S. Department of Health and Human Services. So they are also in charge of looking at the medical products for tobacco, food and veterinary medicine, global regulatory operations and policies, and overall operations. They look to protect the public health by assuring the safety, effectiveness, quality, and security of the human and veterinary drugs, other vaccines and biological products, and medical devices. It's extremely similar to the Department of Health and Human Services and could be very comparable to that one because they are within it. So they do report still to the U.S. Department of Health and Human Services, but they regulate nationwide. This agency is the Florida Board of Medicine. The Florida Board of Medicine was established to ensure that every physician practicing in this state meets the minimum requirements for safe practice. The practice of medicine is a privilege granted by the state. The Florida Board of Medicine is a dedicated organization for licensing, monitoring, and discipline and educating and physicians and other practitioners to assure their fitness and competence in the service for the people of Florida. The importance of this agency is to assure that everyone practicing medicine in Florida is held accountable for their actions and making sure that they meet any kind of requirements in order to be safe and to ensure the health of everyone. This also only allows for state by state, so they do not have to do any federal any federal accounts, but this could also, the con of having it only state by state is that other states might have higher levels of adequacy, and it can hinder or hold other states higher up in the medical boards. Overall, all 6 agencies intertwine together to ensure the health and safety of all Americans. Although some report directly to the Department of Health and Human Services, like the Center of Medicaid and Medicare, as well as the Food and Drug Administration, they all report to the federal government, except for the state board, which has its own accountabilities that they perform within the state.